Live giving you health tips on genital urinary system. Yes, we're giving you live section on genital urinary system. So today our lecture is based on we're giving health tips on genital urinary system. So what do we understand by genital urinary system? The genital urinary system refers to the urinary system and the reproductive systems. We have the urinary systems and we have the reproductive system. Why being called genital urinary system is because the urinary system and the reproductive system both work hand in hand together. And as you can see through the anatomy, you can see it's both. You can see they are both on either from behind or within. They are both in a way where you see the genital. When you see the reproductive system, you're also going to see the urinary system. So they work hand in hand together. At times, without the urinary system, the reproductive system cannot function properly. And also, vice versa, if if there is no availability of the reproductive system, the urinary system cannot also function properly. So they both work hand in hand together. So genital urinary system is a combination of both the urinary system and the reproductive systems. What do we get to understand by the urinary system? The urinary systems, this make up some certain organs, and it can be found in both male and female system. They are both the same thing. The urinary system of assigned male at birth and assigned female at birth are the same, such as the kidney, the urethra, the bladder, and the urethra. This also can be found in the female, while also it can also be found in the male. So they are both the same. The urinary system of a male is the same as the urinary system of the female. So there is no difference. So what we understand by the kidney, as you can see, you understand the fact that the kidney filters the blood. It removes waste materials, balance the fluid, and also produce some certain urines just to assist the body. And when the urinary system is functioning properly, most especially the kidney, the body is on an healthy state of mind. And the moment there is any abnormalities to that, there is a huge problem to the body system, because the kidney functions is very highly important, to eliminate some certain fluid and to filter the blood, just to make sure everything is in order. So the moment there is any abnormality to this, then there is a huge problem to the whole body system. So we're talking about today, like I said earlier, for those of us that were just joining us right away, we are talking about the tips on the abnormality. There are some certain abnormality that do occurs to both this system, both the urinary system and the reproductive system. So on this abnormality, we'll be talking about the causes, the symptoms, the preventions, the treatment, the management, also, and how to maintain, which is the tips on that, and how to maintain a healthy state of the genital urinary system, which comprises of both the urinary system and the reproductive system. So for the urinary system, like I said earlier, it comprises of some certain organs, which I name: kidney, the ureter, the bladder, and the urethra. The kidney stand as to filters blood and also to remove some certain waste materials to balance the fluid and to produce urine. you know why the urethra, it connects to the ureter connects to the kidney, and it connects to the kidney, also connected to the bladder. So this is where the waste products pass through to the what? To the kidney. I mean, to the bladder. So, and this bladder is just like a balloon shaped, it's balloon shaped organ that houses the urine. So the more the urine comes in through the ureter to the bladder, it increases in size. So there is a certain size that it will get to, and that won't be able to contain it again. So why the urethra connects the bladder from the pelvic, connect the bladder to, the urethra connects, it's connected to the bladder just for the urine to assist the body. It is the one, the two at the bottom of the bladder that connect with the bladder just to make sure the urine assists the body. So why am I breaking this down for us to understand? Is because a lot of people might not get to understand all the what really makes up the urinary system, because it is very much important. The moment you begin to observe some certain abnormality, then you will be able to identify the certain area which the abnormality is coming from. Well, we are still going there, but within time we're still going there. But right now, so when we're talking about I see that. Thank you. You can join us live on this section. It's all about health tips on genital urinary system. For those of us that were just joining right away, it's health tips on genital urinary system. The abnormality, the causes, and the likes. So we should get to understand the fact that the moment we begin to observe certain abnormality, then we'll be able to identify the parts where the abnormality is coming from. Take, for example, before we move ahead, for the urinary system, which comprises of some certain organs, which are the kidney, the ureter, the bladder, and the urethra. So take, for example, there's some certain abnormality to the kidney. You'll be able to realize that at the top of your waist, you begin to, we have the left and the right kidney. We have the kidney, it comprises of two organs. We have the left and we have the right. So the moment you begin to feel some certain pain to the left or to the right, like I just giving an example to that. The moment you begin to feel some certain pain here, maybe some certain pain or tingling or whatsoever, we'll be able to know that maybe you are having some certain issue to the kidney. Why am I telling you the area where the kidney is being located? Is that when you are observing some certain pain towards these particular areas, then you'll be able to know. That is for the clinical review, clinical examination, we'll be able to know if you are having kidney stones, nephritis, and the likes. So take, for example, there is a kidney stone. You will feel some certain pain towards this left and the right side of your body. Then the moment you begin to feel this pain, certain diagnosis is needed to be done, which is ultrasound or MRI scan or CT scan. So either of these scan needs to be done. So the moment you go for this diagnosis, and we try to check on the that is abdominal pelvic scan, you do some certain abdominal scan. So this abdominal scan will be able to review if there is certain abnormality to the kidney. Today we are emphasizing on the urinary system and the reproductive system. So that's what we are emphasizing on for today. We're still going to move ahead to the other part of the body. You know, we have we have thousands different abnormalities affecting the whole body system. But right now, our major topic for today really emphasizes on genitourinary system, which comprises of both the urinary system and the reproductive system. So now we are on the urinary system, which comprises of some certain organs, which are four. Then I named them earlier. We have the kidney, we have the ureter, we have the bladder, we have the urethra. And this kidney is found at the top side of the body, both the left and both the right hand side and the left hand side. So the moment you begin to feel some certain pain towards the left hand side and the right hand side at the top of your ribs, then we ask you to do some certain you have to be checked. You have to go for some certain diagnosis, which we call tests, or we call it examination. So what is the type of diagnosis? It is, firstly, it is going for certain ultrasound scan, which we call abdominal scan. We call it abdominal scan. So through this scan, either you go for ultrasound scan, or you go for MRI scan, or you go for CT scan. Either of this scan will review if there is any abnormality to the kidney. So take for example, if there is any abnormality to the kidney and you're feeling some certain pain at the right and the left hand side of the ribs at the top corner, then it's okay. When you're feeling this certain pain, you go for any of these scan first before you go further to some certain blood tests and the likes, and the urine tests and the likes. So for us for first examination to be done is we go for ultrasound scan and MRI scan or CT scan. But if I would say, MRI scan, which is magnetic resonance imaging, it really brings a lot of, it gives more clearer view. Yes, thank you, sir. I can see that. Thank you, sir. My pastor, Oluwatosin Joseph. Thank you, sir. So please, you can share with us, sir. You can share and likes and comment. And you can ask questions as well, whatsoever it is that we don't get to understand, even though it does not relate with what we are discussing right now. It doesn't matter. We are always available for you to answer each and every question regarding to any abnormality that one is observing or facing or has been treating towards his or her body system. So, not to, sorry for the little bit digression, but we just have to make sure everyone gets to understand the purpose why we are on live session right away. We are on live session just to sensitize people, to make sure that everyone gets to know some certain health abnormalities, some certain things that needed to be known before it gets out of hand towards our wellness, toward our healthy living. So, like I said, I'm making us to understand where the urinary system organs is being located. Take for example, which comprises of four organs. We have the kidney, the ureter, we have the bladder, and we have the urethra. And I said the kidney, you can find at the top corner side of the ribs, because it comprises of two organs, the left kidney and the right kidney. So the moment there are some certain abnormality to the kidney, that it won't make it to function properly. Take for example, when you're feeling some certain pain towards the right and the left kidney side, then you should be able to, the moment you're feeling some certain pain or some certain, yes, it's gonna show up like a pain. Firstly, these are some certain physical expression that you first observe. When you feel some certain pain, it can be kidney stone. So the next thing you need to do is that whenever you're feeling some certain pain at your right side or the left hand side, top corner, at the ribs, top corner here, then all you need to do is to go for ultrasound scan And this ultrasound scan, what you're going to ask for, you tell the sonographer that you want to check on abdominal scan, or you say abdominopelvic scan. So it's going to showcase all the organs. It's going to showcase all the organs, and they're going to they're going to look into any abnormality. But right now, we are only emphasizing on the urinary system, which we are not going further on any other system. But today we are talking strictly on the genitourinary system. I keep on repeating myself due to the people that were just joining right away. That's why I keep on repeating some certain words, just for us to to follow us up. So I don't want anybody to be left behind. I don't want anybody to be left behind. I want all of us to get along, as I'm saying. So like I said, the kidney is located here, and you can see at the right and the left. So when you're feeling if there is some certain abnormality, one can experience some certain pain, either from the left hand side to the right hand side. So when this pain, the pain will look like tingling pain. You'll feel the pain as if something is, you feel the pain like something is obstructing something there. So when you feel this tingling or pain or severe pain to the left and the right, and you observe that, oh, I did not do any work that is so hard like that, whereas there's nothing so much that I've done for the day that can warrant me to be having some certain side pain. I didn't go to the gym, rather do I carry some heavy weights or heavy loads like that, then why am I observing this kind of pain? So the moment you're observing this pain, all you need to do is that you need to go for diagnosis. Then where are you going to go? Then you go to any you go to any laboratory center which comprises of ultrasound machine. So you go for ultrasound scan. Then this ultrasound scan will make you to understand some certain abnormality to the kidney. So if there is any abnormality to the kidney, it will showcase on the results, to showcase on the ultrasound. We have the ultrasound, we have this MRI scan, we have the CT scan, But to me, I will always advise one to go for MRI scan, because for now, we can see is the most highest that can bring more and more accurate result, But that doesn't mean that when you go for ultrasound scan, it will also show some certain things as well. But we have differences. The clearer the image, the clearer the results. So it doesn't mean if you're having any abnormality, 100% certain, ultrasound scan is going to bring it out. It's going to showcase it. It's going to let you know that you are having some certain abnormality to your kidney. So when the moment you notice this these symptoms that you are having this pain, you go for ultrasound scan, and what you're going to ask for is you want to check on abdominopelvic scan, which comprises all the organs related to the body system, most especially the kidney, the liver, and the likes, the uterus, and the likes. It's going to bring them out 100% full. So now, the moment you also begin to notice some certain foul smell, even though you don't notice that you are having, if you don't notice that you are having some certain pain, like you don't feel any pain to your left and right kidney, but you discover that you're having some certain foul smell to your urine, like you're having some certain foul smell to your urine, or you discover that your body is itching. You feel itchy body, like your body is itching, like something is moving all over your body, and you feel uncomfortable, or you're feeling some certain hotness from within, and you don't get to understand this hasn't been the way it is to your body system before. Most especially when you're feeling some certain itchy, itchy skin from inside, like you're feeling some itchy skin, you know, you're scratching the whole body, like, oh, something is wrong. Like something is wrong. Like you're feeling some certain itching skin. So and you notice that this does not go with time. Then this has been coming up and up and up again. Like the itching, you know, you use some certain drug and it doesn't work. Like you use some certain antihistamine just to control the itchy part. And the moment you use this certain medication, it goes with time and it comes back again. So what you need to do is for you to do what? To check on urinalysis. You know, checking on urinalysis will make us to know if you're having some certain issue with your blood, and if there is any issues with your blood, then it means, take for example, when we check on your urinalysis and we discover there is any abnormality to the blood, it means you are having proteinuria. And when you're having proteinuria, that shows that the kidney is having some certain infection. Take for example, like nephritis. So it shows that the kidney is having some certain infection. Mind you, what I'm saying is that if you're feeling some certain itchy body, like itching skin, like you're feeling some certain itchy, you know, it is not, you know, you can feel itch, you know, you can feel itching skin here, and not, you know, there's some certain itchy skin that it will overwhelm your whole body system. Most especially, you begin to, you know, scratch your head, your eyes, or your body, and you say you just take a shower and, you know, you just feel uncomfortable. Do you understand what I'm saying? And this has been coming up and up and up. So all you need to do is for you to go for a urinalysis test to check on your blood system. You know, we have to check on the blood and some certain electrolytes. So when we get to discover that your blood is having, when we get to realize that you're having some certain positivity in the blood from the urinalysis result, it shows you're having proteinuria. And when you're having proteinuria, that means your body system, that means your kidney is having some certain infection. That means your kidney is having some certain infection. And this has to be taken care of. If it is not taken care of, it can lead to total breakdown of the kidney. It can lead to total breakdown of the kidney. So what are you going to do? What you need to do is that you need to check, the moment you're feeling the itchy, you call your healthcare practitioner. That is why we are available for you. You can reach us out on any of our social media platforms at BMS Healthcare. You know, when you get to our social media platforms, you're going to see our phone numbers right away. And these are phone numbers. You can send direct messages. You can also give a call direct. We are always available for you guys. So, and the importance and the let me say the advantage of you reaching out to BMS Healthcare Medical Consultancy and Services is that we'll let you guys to know the right thing at the right time. You know, we'll let you guys to know the right thing at the right time. We'll let you guys to know the type of people that you need to meet, like the type of the right healthcare practitioner or healthcare professional that you need to meet. You know, maybe you need to meet some certain healthcare practitioner and you're meeting someone else. No, we are going to tell you the right physician. We are going to direct you to the right physician, even though we are not around your area. No, that is not a barrier. You know, distance is not a barrier when it comes to our management, you know, when it comes to the way we attend to people. You know, we're bringing up the ideas that you can reach out to everyone and you can, you know, you can have a business with anyone all around the world without even getting to see each other seeing each other in person. So what we're going to tell you is that we're going to tell you some certain things. We're going to ask you some certain questions, which that is a consultation. Then after the consultation, we're going to know through the consultation, that is, it will include some certain, we'll get to know some certain clinical examination. We will have done the clinical examination by what you've shared with us. Then after that, okay, again, bro, you know, you just send me you send me direct message on, you send me direct message. You can send me direct message on my messenger. When I get to see you, Mr. Ogene, I will reply to your message. Whatsoever question you need to ask, you can ask the question right away. But if it is confidential, you leave a message for me. Then I'll call my WhatsApp number right away. My WhatsApp number is 070-899-79560. That is my WhatsApp number. 070-899-79560. That is my WhatsApp number. You can message me on WhatsApp directly, and I will respond to your messages as soon as possible. As soon as possible, I get to see your message, after the live section. Right away now, I can't attend to any direct messages on my phone number, either on WhatsApp or direct messages on the phone number, and I can't pick calls right away. But all I will guarantee is that as soon as possible, I'm through on this live section. I'll end the live section. Then I will surely respond to each and every messages. And if you know that you can ask the question, if you know it's a question that everybody can, benefit from, you can ask the question directly here. We'll surely answer you whatsoever it is you don't get to understand. We'll answer your question. And if it requires we should talk after the live session, we're going to do that as well. So like I was saying, sorry for the little digression for those of us that we are following. And please share and message, comment, and tell us what you need to know and what we can do and the assistance we can also render. So I'm saying that at BMS Healthcare, we reach out to people based on the fact that we want everybody to benefit from, we want everybody to have the idea of self-care. Yes, we want everybody to have the idea of self-care. That is why we established this platform, that reaching out to people and making them to understand how to have the knowledge of self-care. Because I always tell people that at times hospital is very much important. We need to have a register. We need to register ourselves, our family, in one hospital or the other. This is very important. In case of any total breakdown, then they'll be able to attend to us. It's very important for us to register in any healthcare facility around us. And you make sure that the healthcare facility you are going to register is going to be closer to your area, should be case of any abnormality, any total breakdown to the body system. And but at times, not everybody love visiting hospital. Some certain people will like, going to the hospital right away is I'm so scared, I don't like going to the hospital. If you are the type of person that you don't really like going to the hospital, then I will advise you that you need to have a healthcare practitioner, a healthcare provider, a healthcare professional that will be overseeing your wellness, that will be overseeing your health status. You understand what I'm saying? So it's not until you fall sick before you get to meet someone, right? Before you reach out to people. No, it is not until you fall sick. So you get to reach out to people. You get to have, either you employ or you have a healthcare practitioner around you that you can, give a call to. And the benefit of this is that since you are a type that you're scared going to the hospital, so whenever you are noticing some certain abnormality to your body system, so you'll be able to have a free access to call or to message your healthcare provider that, Mr. Man, I'm having I'm experiencing some certain symptoms, which this has been giving me some certain concern to my body system. So what your healthcare practitioner or the healthcare provider, whatsoever he or she is, will be able to put you through what it is that you are observing. Then he or she will be able to tell you the right thing to do and what to do. The earlier the better you discover some certain illness and diseases, the faster it is for you to get rid of it. So, but the moment you keep mute and you're like, I'm a type, I'm always okay. Yes, you're always fine and you're always okay. But mind you, What I do always tell people is that diseases, viruses, bacteria, or whatsoever antigens does not affect the immune system if it is not introduced to the body system. You might be a type of person that, well, I don't used to do this, but what about the things? What about the food you eat? I don't used to smoke, I don't used to drink, then I know I'm okay. No, it does not mean that when you're not smoking or you're not drinking alcohol, maybe you're a kind of person, you don't consume alcohol and you are not smoking, doesn't mean that you won't fall sick. Yeah, you will actually fall sick. I don't pray for everybody to fall sick, but what I'm saying is that there are some certain food that you think is okay and is beneficial to the body system that you are consuming, that you think, since I'm consuming this certain food, I won't have issue. Take for example, rice is good, rice is good, beans is good, and the like. But the moment you eat too much of rice, it can result to what we call diabetes. So there is nothing that you consume too much that will not result to there's nothing that you consume too much. Yes, my evangelist, sir. Thank you, sir. Health is wealth. Yes, 100%. Health is wealth. Thank you, sir. Health is wealth. So, if you don't have a healthy lifestyle, then, all your money you have, how do you want to enjoy it? All your things, all your wealth, all everything, how do you want to enjoy it? No. So, health is wealth. Thank you for that. So, as a matter of fact, what I'm saying is that the moment you begin to the things, the moment you consume some certain food, some certain chemicals, some certain drinks, even though you think this drink is okay for your body system, yes, it is okay. But when it is getting too much, when it is too much, it will cause some certain damages to your organs, to some certain organs, which I make example of rice, because it is carbohydrate, and excessive consumption of rice can lead to what? Diabetes. Take for example, and to your own understanding, to your own knowledge, you are like, but rice, rice is not a alcohol now, so I cannot have issue with rice. No. Even though you consume too much of protein, if you don't follow some certain health rules and guidelines, these proteins, each and every food or chemicals you consume, they are acidic, they are acidic, and they are also poison. I hope you all understand. They are also poison. And how does it become poison? Because during metabolism, we have what we call free radicals. And during all these free radicals, if you don't flush, if they don't exist in the body system, they will turn to what? They will be harmful to the body system. These free radicals will be harmful to the body system. So if it is not being, flushed out of the body system, it will be harmful. It will cause damages, to turn to poison and begin to damage the cell gradually. So food can also be harmful to the body system. So how will you now know that? How will you be able to tackle all these issues when you begin to feel some certain symptoms? It's for you to have a right healthcare practitioner around your area, or you can reach us out at BMS Healthcare. They will begin to give you some certain guidelines for how to live a healthy lifestyle. So like I was saying, we're talking about the genitourinary system, which comprises of both the urinary system and the reproductive system. But right away, we were only emphasizing on the urinary system, which comprises of some certain organs, and these organs are the kidney, the ureter, the bladder, and the urethra. And this kidney, its function is very much important in the body. Take for example, all the food you have consumed overnight, we have something we call metabolism. And during metabolism, all this food is going to be breaking down. So as soon as possible, they are being broken down, the liver act on them, and immediately everything is being done, then it will pass to the kidney, and the kidney will have its own work to do. What is the work the kidney needs to do? This kidney we do what? We remove the waste out of it. You know, we balance the fluid. We have some certain electrolytes that needed to be balanced, that need to be in a homeostatic condition. You know, the kidney is the one doing the proper functioning on them, and the production of urine, you know, it will remove some, it will filter the blood. There are some certain chemicals, there are some certain things that the blood does not need. So the urine, the kidney will be the one to filter these out. So when the kidney filters them out, it will pass some to some certain area that needed to assist the body. You know, you see, you can sweat, you can make urine, and you can stool and the likes, and so on and so forth, like that. So the function of the kidney is highly very important in the body system. It's very highly important. It's very highly important. So I said, when you feel some certain pain at the right side, at the right corner at your ribs, you know, when you feel some certain pain, then you should be able to know that one is having some certain abnormality to the kidney, either the left side or the right side. So then you need to go for what? Abdominal pelvic scan. Like I said, the kidney is very important. You know, it serves to remove any waste product and to balance fluid, to filter the blood, and to make everything function properly. And the moment your kidney cannot filter, the moment your kidney cannot balance fluid, the moment your kidney cannot produce urine, you know, then, or remove waste particles, then there is issue. Then we'll have something we call fluid retention. Then there will be a fluid retention to the kidney. The kidney begins to increase in shape. It will begin to increase in size. You know, it will begin to increase in size. It will begin to increase it will begin to increase as soon as possible. This increase begin to relate. As soon as possible, you begin to see the increase in the fluid retentions to the kidney, then there is a problem. The next thing you begin to say is that your body begins to malfunction, because the kidney must not retain any fluid. The kidney must not retain any fluid. The kidney must not retain any fluid. Like the fluid being retained, too much of retention of fluid in the kidney will affect the kidney, not to make it function properly. So please and please make sure that your kidney, make sure that you have a healthcare practitioner that will be looking ahead, you know, that will be foreseeing everything that is happening to you as an abnormality. So your kidney must function properly. Your kidney must function properly. Urinary system comprises of the kidney, the ureter, the bladder, and the urethra. Now we're going to the urethra. The urethra is the one that, you know, they are the connecting tiny tubes. You know, it is a thin tube that connects to the what? It connects to the kidney. And this kidney, from the kidney, when it's removed the waste products, you know, I'm breaking it down for us, for us to get to understand, you know, because some terms and terminologies which you guys will not be able to understand. So what do you understand by remover? That means to say take something out. That is the work of the kidney. Take something out. You know, to remove something is to take something out. So, and it functions to take anything that is not beneficial to the body. It takes it out. So it removes any waste material, any waste product in fluid-like. In fluid-like, it will remove them out. So for a layman to understand, please get to understand the fact that if your kidney is not be able to remove some certain product out, if it's not responsible, if it is not removing some certain product, it is a problem. It is a huge problem. So, and where does this come through? It comes through, it passes through the what? It passes through the ureter. The ureter. It passes through the ureter, and as soon as possible, it passes through the ureter to the bladder. You know, this bladder is just like a tank. It's just like a tank that whatsoever it is coming through the kidney to the ureter, it goes straight to the tank. So the tank houses, you know, the waste product, the waste fluid, such like in urine, like in nature. So from the tank now, it passed through the what? The urethra. The urethra you know, it's a tube, it's a tiny tube. So we are still going to the reproductive system. But now I just want you to understand that what urinary system is all about. So it will now pass through the urethra outside of the body. So the moment it passes through the urethra outside the body, then the body be, you know, feel comfortable. Then you'll be at ease. Take for example, when you feel pressed, you know, when you feel pressed is the condition whereby your bladder is full. So when your bladder is full, you begin to feel some certain pain. You begin to feel some certain pain, like you feel pressed that, oh, I want to make urine. So if you don't go and urinate, you know what will happen next is that this fluid that is present in the bladder will go back. Some will begin to go back. You know, the bladder is full. Then it will go back. It will follow where it comes. It will follow it back. That is the urethra, back to the kidney. And I want you to understand this fact that the heavy of your urine is acidic in nature. Then the kidney has already filtered it away to the septic tank, that is the bladder, for the bladder to, you know, to remove the waste material through the urethra. And if you feel, maybe you're like, oh, I'm the kind of person that if I feel pressed, I will not urinate for like 1 hour. I'm in a car, you know, when I'm traveling, I don't like stopping the car, you know, I don't like telling the driver to stop, or I'm the one driving, I don't like stopping by the roadside and ease myself, you know. No, if you are the kind of person like that, please stop it right now. Just stop it right now. Just stop, because before you know it, you are damaging your urinary system. You are damaging your urinary system. If care is not taken, this will result to some certain total damages. You know, it will begin to malfunction little by little. It will begin to malfunction little by little. And before you know it, it will just get to a stage where it will just shut down. And when your urinary system is being shut down, you know, then you begin to observe what we call dialysis and, you know, surgery to the affected area. I hope you understand. Then if care is not taken, then you begin to, you know, it will lead to death. You know, I won't say much more than that. It will lead to death. And a lot of money that it will cost you. And let me tell you this part. As soon as possible, there are some certain surgeries being done to some certain organs. They can never be the same again. But I believe in the miracle of God. It can, you know, it can come back. But anything aside of miracle, it can never be the same again. There are some certain organ, if the organ has been, you know, if there are some certain surgery being performed on them, they can never be the same again. You just begin to manage them, and you begin to go to the hospital for some certain management. And if you don't go, if care is not taken, it will be total shutdown. And when it shuts down the second time, you might not have the grace, you know, to receive some certain healing again, you know. So I would just advise us that, you know, coming to the maintenance part or going by some certain abnormality to that is that when you begin to notice that your kidney, when you begin to notice that you are unable to pass urine, you are unable to make urine, you are unable to, you know, to ease yourself, you know, it is a situation, it can lead to what we call infection. We call it UTI, that's a urinary tract infection. And it can also be sexual transmitted disease. So it can always lead to sexual transmitted disease, urinary tract infection, and the likes. So whatsoever it is, the moment you begin to discover that you are unable to make urine, then what you need to do is just to call your healthcare practitioner, or you go to the nearest hospital. Then when you get to the nearest hospital, what they are going to do, or the things that they are going to ask you, or what they are going to do for you, is for you to undergo some certain diagnosis. We call it diagnosis, you know, that is some certain medical term. Then we can also call it what? Tests. This is a general thing for all of us to understand. So I will call it test, you know, for everyone that is on here to understand. I will call it test. So they will say you should go and do some certain tests. So when you do this test, they will ask you, maybe you do some certain tests. They will do some certain physical examination for you. Like, for example, you're unable to urinate. So when you're unable to urinate as a male or female, they will do some certain physical examination for you. And this physical examination entails, like, they will press your bladder, that is at the pelvic side. They're going to press it. And when they try to touch it, they'll do some physical examination. And when they do the physical examination, you know, whatsoever the result is being given to them, then they will note it down. And the next thing they are going to do is that they will ask you to do some certain tests, and that is a diagnosis. And this test is they will surely ask you to do urinalysis, or you know, they're going to, okay, even though you cannot make urine, there is a way that, you know, we're going to get your urine empty. They're going to empty your bladder. It's going to be emptied, and there is a way we do that, which I will not be I won't be able to say that here. You understand, because that is confidential. Then there are way we can remove the urine, even though you cannot be able to make urine. They have to make it out. You know, the way to do that without, it's not a surgery. So after it's been done, then because when I say it out here, a lot of people can be doing that at home. No, it is not required. So when you get to the hospital, even though you can't make urine, there's a way we're going to take that out. When we take the urine out, then we are going to we're going to run some certain tests on it. And this test comprises of urinalysis and MCS. So when they do the urine MCS and the urinalysis, we'll get to know if there is a traces of infection. And if there is a traces of infection, then infection is going to be treated. Whatsoever infection it is, you're going to be treated. And if it is the result of prostate enlargement, we are still going there, because if we are to talk about prostate enlargement, that is, we are going to the other side of the reproductive system. But right now, we are only focusing on the urinary system. So for us to get to understand the major things we are talking about, we are still going to the reproductive system, because the reproductive system and the urinary system work hand in hand together. You say, some people might be asking, what do you mean by the ureter? The ureter is being housed by a reproductive organ. And what is this reproductive organ? That is the penis. I hope you understand, the penis. So the ureter is inside the penis. The urethra is inside the penis. That is where your pen, or it is inside the we have something to the female, that is the male, it is inside the penis, and for the male, it is housed by their genital, organs, such as the labia majora, the labia minora, but it is located, the urethra is located, that is, a tiny tube is located between, it is located at the top of the labia minora. For the female, it is located at the top of the labia minora. So it is located at the top of the labia minora. The labia minora is the one that houses the urethra of the female, while the penis is the one that houses the urethra of the male. I hope you understand. So we are still getting there, but right now we are just talking of some certain abnormality that one can observe in urinary system. So it is possible for you to observe that some abnormality is one, having difficult in urination to pass urine. Then, we have some certain pain, that is kidney stone, and we have some certain issues that will warrant some certain pain from the bladder. One begin to feel some certain pain in the bladder, to the pelvic area, one begin to feel some certain pain. So these are the abnormalities, or some of the abnormalities that one can begin to encounter. But when we are talking about the combination of both the reproductive system and the urinary system, there is a lot of abnormality, and we are still going to bring them two together. There is a lot of abnormality that do occur with both the reproductive system and the urinary system, because the moment the reproductive system is having issue, it will surely affect some, really, not not some self, mostly we affect the urinary system. And when the urinary system is being affected, it will also affect some parts of the reproductive system. So they work hand in hand together. Take for example, when you have infection and you are unable to, when too much of infection is occurred, it can increase the rate of your prostate if care is not taken. You know, when you have some certain lifestyle, and take for example, you're having some certain lifestyle, unprotected sex, and one is being contaminated with some certain diseases or whatsoever it is, it will relate to swelling of the scrotum, can relate to the swelling of the scrotum. And when the scrotum is swollen, then all the organs that the scrotum houses will also be infected, like the testicles, like the epididymis, like the bulbourethra, like the prostate. All these, a lot of organs. We have it 9. There are 9 organs that, that the reproductive system of a male is having. So when infection takes place, when infection gets through the urethra, then this infection is not taken care of. It will surely affect the whole reproductive system. The moment it affects the whole reproductive system, then you know what that means. The moment it affects the whole reproductive system, then the body is on stable state. All the whole body is on a stable state. So one will be rushed down to the hospital for emergency, purposes. And please, like I said, if you don't get to understand what I'm saying, you can DM me direct message on my messenger or on my WhatsApp. 070-899-79560. You can come down, At least I'm breaking it down for a layman to understand. All I'm saying, I'm breaking it down for a layman to understand. So I'm trying to let you guys to know on a normal time so that you can be able to get to understand what I am saying. So what I'm saying is that urinary system can, there are some certain abnormalities to the urinary system. Then I made mention of the abnormalities, which is very common. And the causes of these abnormalities now goes by 1. Take for example, if you're having kidney stones. If you're having kidney stones, it means that it can be due to medication. It can be due to some certain medication that one is taking. Yes, if you're taking some certain medications, it can affect your kidney to shut down and unable to filter some certain substances. Yeah, and also that is medication, some certain drugs like that. So also, if one is taking some certain foods, take for example, maybe you're one that you like fatty foods, like you love to eat fat and oil too much, and you like to consume a lot of meat, like you love eating meat. You understand? I'm not saying it's not good to eat meat. No, it's not bad, but some certain consumption of food substances, can cause some certain things. Take for example, for the kidney stones, 1. And also, if you are not assisting your kidney to filter the blood, to remove some certain waste, to balance the fluid, to produce urine, the kidney is meant to filter every unwanted substances out of the body, which stand as the excretory system. I hope you understand. So if all these things if the kidney is unable, you need to assist the kidney. How will you do this? Is by you drinking water. When you wake up in the morning, overnight there's what we call metabolism. And what you need to do is that you need to drink water. That's why we always advise people that you take some certain water. Like, take for example, when you wake up in the morning, it is expected of you to drink nothing less than 1.5 liter or 1 liter of water in the morning. So I always tell people that it can be difficult for you to drink 1 liter on a glance. No, you can take it like within 10 minutes, you can drink 1 liter within 10 minutes. let's say you drink 50 cl and the next, then you can just take the other 50 cl. So within 10 minutes or 20 minutes, you can drink 1 liter of water. And if you are like type that, no, you can drink 1.5 liter, yes, no problem. But this 1.5 liter, you don't have to drink it once. You have to drink it with a range of 20 minutes because you don't have to stress your kidney as well. Because now the doctor or an healthcare practitioner has told you, or that tell you that you should be drinking water in the morning. Then all you need to do is just take 5 liters of water and begin to drink. No, no. There is always, you know, a certain precaution pure water pump, and in the next 10 minutes you can go back and drink the rest. So you just make sure that you finish 1 liter of water within the range of 30 minutes. You know, everything has to be in minimal, in medium. You don't just take things the way it is. You don't just eat things the way it is. You know, you just have to take some certain things at the right time, which is very important. So please and please, if you are to drink water, know how to drink. And how will you be able to drink water for you to get satisfied? Is taking it within the range of 20 minutes, drinking 1 liter or 1.5 liter within the range of 20 minutes. So if you drink this water in the morning, it will assist your kidney to filter every fluid. It will really assist your kidney. And when your kidney is being assisted, then you will see that when you drink the water, you will try to make use of the toilet. That is your restroom. You try to make use of your restroom. And when you do that, fine, you see your body is going to be empty. And let me tell you, you will not even feel, you won't feel like, you won't feel hungry. The moment you inculcate the habit of drinking water at normal room temperature every morning, you won't feel hungry because you won't feel starvation, because your stomach will be full. Then the moment it is full, your kidney will begin to filter some things out. Will begin to release some waste particles out. Then all you need to just do is just making use of the restroom. That is your toilet. So that is that on that. Drinking water. And if I would say, it depends on how our statures look like, the weight we carry. You know, for someone having like 60 kg, 60 pounds, that weigh nothing less than 60 pounds, you know, I won't tell the person to be drinking warm water every day, because if you're drinking warm water every day, every morning, you know, it's going to reduce your weight, because warm water stand for, you know, it stands for a lot of, it stands for weight reduction, replenishment of the whole body systems, a lot. But the only disadvantage is that you're going to reduce in weight. So we always advise people that you know, we always advise people that have much of weight to drink warm water. So because the moment you start drinking warm water, it will reduce your size. It's going to reduce your size. So reducing your size now, we help a lot of things in your body system. So warm water is okay and normal water is okay, but you need to reach out to your healthcare provider to give you more details on that. You can send us DM here, then we'll give you more details on, because we are going to do some clinical review on you, clinical examination, to know if warm water will be good for you. Because having ulcer, we cannot tell you to be drinking warm water. So I will not say everybody should be drinking warm water here. So we can only advise or introduce or tell you to do some certain things that aligns with your certain health condition. So if you're someone that has been diagnosed of ulcer, we can't advise you to be taking warm water. You understand? And if you will take warm water, there is a limit to it, and there is a way the warm water will boil. You know, there is some certain degree Celsius that you are going to be taking, and when you take that, we're going to reach you out. Do you have any abnormality after you have taken this quantity of water? Then if you said yes or no, they will tell you what to do and how to do it and the next thing to be done. So you always, whatsoever it is to keep your healthy state, you need to have a healthcare provider or healthcare professional that will be overseeing you, that will be supervising you. And the moment you have this person supervising you, it will make you to understand more about keeping a healthy lifestyle, you know, to keep a healthy state of mind. He or she will help you a lot, and this will forever help you to, you know, to live longer than expected. So like I said, what are the conditions affecting the kidney not to filter or to work properly on each and every substances that we consume to our body system? Is that if it is lack of drinking water when we wake up in the morning, like, you know, some people can eat a lot of food, but when you ask them to drink water at the end of the day, they will say, no, 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 I'm not drinking water. Even what you don't know is that you are damaging your kidney gradually, gradually. Instead of you to drink one water, the next thing is that, oh, I want to take soda. I want to take soda. I want to take certain drink, and this drink contains some certain caffeine. You know, I will not make mention of some certain drink here. You know, then you begin to say, oh, I want to take some certain drink, and all these drink contain caffeine that when you open it, you know, it has a lot of gas, and it also comprises of sugar. Instead of you to drink water, then you prefer taking that. You know, you go to some certain eatery and some certain likes, and you eat some certain food. This food is comprises of, they are all processed food, which comprises of some certain chemicals, you know, some certain things that, you know, some certain spices, and you just, oh yes, and the next thing you order for is that, oh, give me some certain drink, oh. And this drink, you believe that, oh, you are enjoying your life, not knowing that you are damaging your kidney. Not knowing that you are damaging your kidney gradually, gradually. So instead of you to take water, you won't take water. And instead of you to take water at normal room temperature, you will also order for cold water, cold chilled water, and not knowing that all this thing is damaging your kidney gradually, gradually. Yes, you can say you are living so good, and when you now get to your late 50s, then your body begin to malfunction. Instead of you to have some certain strength, you begin to lose strength. What is the causes of this? It is how you have lived your life during your adulthood. You understand? During your young age, that is the result of what is happening to you at your old age. That is the result of what is happening to you. A lot of people do come and we do some certain you know, they come for consumption. Know by now, to be able to know by now that consumption of too much of alcohol, it is a problem to the body system. So it's better for you, instead of you taking alcohol, because each and every food you drink, even though the body at times, maybe one says need alcohol and the other one, but we don't know that each and every food that we are eating, there are some certain food being consumed that there are alcohol inside. During metabolism, everything will be what? Will be breaking down and be released to how it's going to some certain cells and organs and tissues to hold the whole body system to function properly. So it is not by only taking alcohol in a raw that we know that, oh, yes, I've taken alcohol. No, 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 no. So please and please, let us get to understand this fact that we need someone to oversee us in things that we are doing. So we are going straight to how to maintain our kidney. I mean, how to maintain our urinary system, which is the kidney, the ureter, the bladder, and the urethra. You know, how can we maintain that? We can always maintain that. We can always maintain that by the fact that, like I said earlier, drinking water in the morning, also cutting back on calories, and also you know, cutting back on the excess of carbohydrate intake. You know, we have some certain type of food. You know, we have some certain classes of food. Rather, the classes of food, we have the carbohydrate, the protein, and the like, the fiber, the vitamin, and the like. So you need to cut back on carbohydrates. You need to cut back on carbohydrates, and excessive taking of some certain foods could also, lead to abnormality to the urinary system. will also lead to abnormality to the urinary system. So let us understand the fact that we need to cut back on these things majorly. We're talking about carbohydrates, we're talking about fat and oil, we're talking about you taking some certain drug that does not really required. If you want to take some certain drug or you want to take some certain medication, you need to have a proper prescription. You just don't work, you don't just feel headache and the next thing is that, oh, I want to go and take so I want to go and buy this thing. No, it is not your line. You need to have someone to put you through. And mind you, taking some certain medication at some certain time, it might not be the problem, it might not be the right medication for you to take. You might be observing what we call typhoid fever, and observing typhoid fever, and you are taking some certain medication, and you don't go for diagnosis, you don't go for checkup, and you just go to the hospital and you're like, I'm having some, I'm not feeling okay, and you are taking some certain, you are just buying something on yourself to your own understanding. It will lead to a lot of problem. Do you understand? This will cause damage to the kidney. So it will cause damage to the kidney, and there's some certain antibiotics that you don't take anyhow. Antibiotic damage kidney a lot. There's some certain antibiotics that you don't just walk to the pharmacy and start buying them. You understand? So the healthcare professional that we introduce or that we prescribe some certain antibiotics for you will be someone that already know you, know your status, know everything, and he or she knows that it is right for you to take it. So if you're having some certain infection or some certain health abnormality that needed to be taken care of, all these healthcare practitioners will be the one to tell you the right to take. They will tell you the right antibiotics or whatsoever medication to take. So if you by your own self going for any antibiotics or whatsoever, it is very wrong, because the moment you begin to consume all these things will affect your kidney. And maybe you need to take this medication for for example, there are doses to each and every medication that you need to take. So you need to take the medication for maybe you have to take it twice in a day, and at the end of the day you are taking it thrice in a day. You begin to weaken the system. You begin to weaken your liver and the kidney. But we are not going for the liver today. We are only talking about the kidney, because we only focus on the urinary system. Because a lot of people might be wondering that, oh, but you did not make mention of the liver. No. We are not talking about the liver. We'll still get to that. We're still going to talk about some certain other organs in the body. But today we're only focusing on the urinary system, and it comprises of kidney, ureter, bladder, and the urethra, which all these are the organs responsible for the urinary system. So if I'm not saying some certain organs or some certain things, we are not on that today. We are only focusing on the urinary system parts. So this kidney, the moment you begin to take this, the moment you begin to consume some certain chemicals in form of food or in form of medication, that is drug. For those of us in Nigeria, we know it's a drug. Why some people in overseas, they know that medication or whatsoever it is, or or medicine. You understand? So if you are taking some certain medicine, this medicine, the kidney will also act on them. So when it is very powerful for the kidney to act on, it will damage the kidney. It will affect the kidney because of the composition that is being made of. So also there are some certain herbal mixture. You don't just take some certain herbal. So when you are saying herbal, okay, I have some certain herbal, there is a herbal tea, there is also tea. No, before you take some certain herbal mixture, you need to consult people. You need to consult some certain people. So when you want to take some certain, thank you, Mr. Gbolagade, thank you so much. You need to consult some certain people. You don't just say, okay, I'm taking herbal mixture, it's because I'm feeling uncomfortable or my stomach is rumbling, then I just go to one Yalagbo and just take herbal. No, or you just say, oh, I think I have an experience of one herbal, then I need to go and take it. No. Herbal mixture which can damage your kidney. because the kidney is going to be the one to filter them. Do you understand? So herbal mixture can damage your kidney, but that is if you are taking the herbal mixture in a wrong way. It is very good for you to take herbal mixture, but if you don't follow a physician prescription and you are taking herbal to your own consent, it is not right. So that is why all those herbal people that you are going to go and take herbal from them, ask them, tell them your problem. So tell them your problem, let them know the right herbal they are going to give you, and let them give you the prescription on the herbal they are going to give you. So, and follow what they are saying. Follow what they are saying. So all these people that they are selling herbal, make sure don't go to them and hide your feelings. You know, a lot of people go to some certain people to get some herbal mixture. You know, because some certain people don't get to understand some certain things about taking some certain things. You know, just because it is not the way your symptom is. It is not the way you are going to approach them. No, because you are feeling highly uncomfortable overnight, and you now go to the herbal cure and you now tell them, oh, I cannot sleep overnight. So I have been having discomfort for like 3 days or like 4 days. So my body hasn't been the same. So what I need now is that just give me something. Just give. No. Because what is happening to your system, it is not that day that came up. It has been, it has been piling up. It has been piling up because when we're talking about the formation of life, the formation of life comprises of the cell, comprises of the cell. That is the compartment of cell, gets to the tissue, then from the tissue to the organ, then from the organs to the system. So before you begin to realize some certain issues to your body system, it is not that day. It is not 24 hours. It has been in your system for a long before. When it don't get to some time, your hormone, there are some certain hormones that help to do or to fight some certain antibodies, some certain foreign invaders. So, some certain antigen rather, that fight some certain, your antibodies, there are some certain hormones. Take, for example, the endorphin hormones and the likes. All these hormones, there are some certain hormones called the progesterone, the estrogen and the likes. We have a lot of hormones. We are still going to talk about hormones, hormonal imbalance, the function of hormones, the function of electrolyte. But when you stay on, when you stay tuned with us, whenever we are going on live session and you see our live session coming up, just make sure that you follow us, because we are still going to talk about the functions and the properties, the functions of the hormones, what they do to the body system. And when you introduce anything to the body system that is more powerful than the hormones will be break down. They will not have power again. So all these herbs, all these medications, even though the modern medication, if you have taken it wrongly, it will affect your kidney. It will damage the kidney. It will damage the kidney. I'm using the word damage so that you'll be able to know the extent that it can affect this particular organ. So I will not even say it in a flexible way for you to say, oh, Shebi, just say it can only affect. No, it will damage it, not affect. It will damage the kidney properly. A lot of, there's something, someone called me and he said, he heard something about vitamin C. And don't you know that vitamin C, we have what we call oxalate. We have what we call oxalate. And oxalate, consumption of too much of oxalate in vitamin C is a problem. So a lot of people were like, but they say vitamin C is okay. Yes, vitamin C is okay. But when you take vitamin C in some certain extent, or you begin to introduce vitamin C to your body system, there's some certain injection or, fluid introduced to the body system that contain vitamin C just for your skin to glow and the likes, and this thing, the too much of this thing will work. Don't you know that all these drugs that we are taking works on the kidney? Also, the kidney will be the one to filter it, will be the one to distribute some certain ones to the certain parts. So when this is too much for the kidney, it will damage the kidney. It is not even affect, it will damage the kidney. So when your kidney is being damaged, it is only miracle of God. Even though you undergo some certain surgery, the moment you undergo some certain surgery, I'm a Yoruba man, and they say, Oju apa o le joju ara. It's not possible. or it is only God that can do that. I'm a Christian, I believe in Christ, you know, and I believe in miracle. So it is only miracle that can restore your health to its normal state. So when you undergo some certain surgery, it can never be the same. When you go for surgery, no matter what, no matter how professional the doctor, it can never be the same. But you will be fine and be healthy. But it will not be as it is, the way God, Heavenly Father, you know, made it. So it will not be like that. It will not be like how the cell being formed and get to the stage it is. No. So just take note, for you to experience anything damage of the kidney, of the urinary system, such as the bladder, such as the urethra, such as the ureter, you know, when your urethra is being damaged, no problem. So what is going to happen is you're going to pass some certain tube to your body system, you know, and that is the end, because you know the urethra is a tiny tube. It's a thin tube. It's a thin tube that connects. It's a thin tube. So I would say it's a wire, that connects with this. Just a tiny thin tube that connects with the kidney. You can see it. When you see the anatomy, you see how it is. You see like this. It's just like a thin tube. The tube connects one. It connects and just goes straight down to the bladder. This is the one that just goes straight down to the bladder. So please, if that thin tube contains some certain infection or contains some certain acid or some certain free radicals, you know that is too powerful. Do you understand? When it's damaged, how can you replace that back? You can replace the kidney, but can you replace your urethra? It is only the miracle of God that can replace that, you know. And if the bladder is damaged, can you replace the bladder? When the bladder is being totally damaged, they're just going to work in artificial stuff for you. So please take note. What you consume, is the major problem that affects the whole body system. So what we are still going to talk more on that, because of people asking some things right now. Okay, but what now? When you wash your medication, you wash the things you do and the likes, the consumption of food substances and the likes. So when you take note of that, you will not have issues with your kidney. You will not have it. When your kidney does not have issue, automatically your urethra, your bladder and your urethra, we will not have some certain issue. But you know that if you don't have issues to your kidney, that is what you take. What about when you introduce your reproductive system, which houses the urethra? That is, maybe you living some certain lifestyle, having some certain fun, having some certain fun, and it results to then you just contact UTI, or you contact sexual transmitted disease, STD. So when you contact all these diseases, before you know it, if care is not taken, it will surely move to the kidney. Do you understand? There is a passage from the kidney to the bladder to the urethra, and there is also a passage from the urethra back to the bladder, and to the urethra back to the kidney. So it's both work hand in hand together. So if you contact a disease or a virus or whatsoever it is from the point of the urethra, it will, if you don't take care of it, it will surely go back and affect the kidney with time. It will surely go back and affect the kidney. So the moment the kidney is being affected, then there will be a total breakdown of the kidney, that it will begin to retain what we call fluid retention. It will begin to retain fluid retention because it will not be able to filter some certain things out. And let me tell you, when your kidney is not able to filter some certain things out to function as an excretory system, which it is, then we have there will be an issue. And what are these issues? Your blood sugar will raise, it will result to hyperglycemia. It will result to hyperglycemia, you know, and your insulin begin to malfunction because your kidney is unable to filter the blood. Did you understand? So the kidney begin to malfunction. When the kidney begin to malfunction, then it will also result to diabetes. It will result because you begin to increase in size, and this increase in size is the result of fluid retention. So you begin to increase in size. You begin to increase in size, and you begin to have something we call edema. Your leg will begin to swell up. Your eyes will begin to swell up. Your hand will begin to swell up, and you begin to have some certain retention at your diaphragm. Your diaphragm will begin to contain some certain fluid retentions, and before you know it, your liver will begin to contain fluid retention. Every part of your body, you know, will begin to retain fluid. That means to say your kidney is not functioning properly. So kidney is something that we should take note of. You know, a lot of people drink beer, they drink consumption of, you know, I'll just tell them, please, sir, if you want to live a healthy lifestyle, you know, you have to cut back on this. I know it's not easy for you to leave it, but you just have to cut back on it, because when you tamper with your kidney, your urinary system, when you tamper with this system, it is total breakdown of the whole body system. It is total breakdown. So, in tó bá ti dé bójú, ó ti dé bámú nìyẹn o. Please and please, to maintain a healthy lifestyle, to maintain a healthy urinary system, which comprises of the kidney, urethra, bladder, and the urethra, is for you to eat a balanced diet, drink water at time due, and take much of fiber. You know, you don't have to eat 3 square meals per day. If you can only be, you can only have 2 square meals per day. That is, you eat your breakfast by 11 o'clock, then you eat your dinner you have your dinner by 5 to 6 o'clock, 6 p.m. So these are the time I do advise my people to have. You know, you can only eat twice in a day. Eating twice in a day will forever help your body system. Or you can eat once in a day. And if you eat once in a day, that is balanced diet. And the rest is just taking fluid. And this fluid is going to be water. And at times, you can take some certain juice. And this juice, which does not contain some certain caffeines, you understand? So you just take some certain juice. Or you take fiber. Or, you know, you can take fiber through what? Through the consumption of food. And you can have your vitamins through the consumption of fruits. I'm saying fruits, you know. We have some certain fruits that helps the body system, and there are some certain fruits that you cannot eat based on the fact that your health does not warrant that. You know, there are some certain food that your health does not warrant. Take for example, like I said earlier, if you're being diagnosed of ulcer of any kind, you know, if you have ulcerative colitis, that is ulcerative colitis that do occurs, that those people also have been detected from your colon, you know, your colon. Either the large, they have the lime, you know, we have the kiwi, any citrus fruits, you know, you are not any citrus fruit or citrus things. If you are having some certain health challenges, you don't have to take some certain fruits because of the acidity, because they contain much of acid, citrus, you understand? So you don't take that. And if you are going to take that, there are some certain ones that you are going to take at some certain time. The most especially if you want to take some certain orange and you know, oh, I love orange, but you are being diagnosed of ulcer of any kind, either it's ulcerative colitis or your peptic ulcer or what ulcer you are having, there are some certain orange that we advise you to drink. You know, the ripe one that when you take it, you don't feel the way it is in your mouth. You don't feel so choked, like you don't feel somehow sour. So what I'm saying is that we need to know the right thing to take at the right time. And who is going to put us through? One is our healthcare provider. And one more thing, or most important thing for us to keep and maintain a healthy urinary system is going for medical checkup at time due. Going for medical checkup at time due. I always tell my people, you need to go for medical checkup monthly. And if you're of a certain age, you can go for medical checkup twice in a week. And if you know you are having some certain health challenges, you can go for medical checkup weekly. So it is very important for you to go for medical checkup. So at least you need to go for medical checkup monthly. Once in a month, you need to check your body. You know, a body that has been working for you for a whole 29 days, on the 30th, you need to go and check it, or on the 1st of the next month, you need to go and check it, the balancing and everything. So that's why I always advise people, go for medical checkup monthly. Monthly is very important. And there is a certain medical checkup that I do advise to do, that is once in a year. And this medical checkup, we have complete metabolic panel, lipid profile, full blood counts, and the likes. So you know, you go for a complete scan. Go for a complete scan, either through MRI scan or CT scan or ultrasound scan. But the one that is very closer to us is ultrasound scan. So it is advisable for us to go for ultrasound scan, and also the rest of the test, that is the diagnosis for the year. You know, it's going to cost you some certain amount of money, but January I will do complete medical checkup. It is very important. That complete medical checkup can take you a week to complete it, but you are having 52 weeks in a year. That shouldn't be a problem for you to go for medical checkup just for 1 week, because there are some that will require you to go for 1 week, that they will be asking you to come. You know, you just have to go for complete medical checkup for 1 week. Just 1 week is enough. It's okay. Health is wealth. Health is wealth. Very much important for you to know that. The way you keep your health, that is how you're going to live longer. If you have billions, you have unaccounted of money, or you know, you have a lot of things and you can't keep your healthy states, you know, intact, your long life is not guaranteed. When it comes to health, your long life is not guaranteed. You know, it is only God that can give long life, but God has also told us to do what? To maintain a healthy state. To maintain a healthy state. God has also told us to maintain a healthy state. God has also told us to maintain a healthy state. You know, I will just take us to a Bible verse here. He said, we have Mark 6, 30 to 32. We have Mark chapter 6, 30 to 32. And we have 1 Corinthians. We have Mark 6, 30 to 32. Let me quickly read that for us. What we are meant to understand about our healthy state of mind. That is Mark 6. Mark in our New Testament is going to be found in New Testament. Mark, that is Matthew, Mark chapter 6, 30 to 32. It states that you know, we just said, I mean, 1 Corinthians, yes, 1 Corinthians 6, 19 to 20. That is that we should honor God with our bodies, and honoring God with our body, we make sure that when we honor God with our body, then we are going to do what? It means that a healthy state of mind will give a healthy lifestyle. A healthy state of mind. That is 1 Corinthians 19 to 20. So please, we need to make sure we take care of our body, so that we will have to live a healthy. He said, what know ye not that your body is the temple of the Holy Ghost, which is in you, which ye have of God, and ye are not your own, for ye are bought with a price. Therefore glorify God in your body and in your spirit, which are God's. I hope you understand. If you don't live a healthy lifestyle, how will you, you know, a healthy state of mind is a healthy lifestyle is a healthy state of mind. When you don't have a healthy lifestyle, how will you be able to honor God self? If you don't keep your body healthy, then you begin to run helter scattered. If you don't live healthy, you begin to run helter scattered. You begin to like, oh, to pray will be even difficult for you. When you know that, oh, I'm having some certain sickness, oh, and they ask you to pray. At times you will pray. Where you are praying, that is where your mind is. So, but when you are living a healthy lifestyle, and you are making sure that your temple is the temple of Christ, you don't live anyhow. You don't just do things anyhow. You understand? So it will even give you morale for you to, it will give you morale self to like, oh, it will give you some certain morale that, oh, I want to live right. I want to worship God. I want to honor God. I want to serve God with everything. So please and please, let us take that. Let's make sure that we really take good care of ourselves, and we make sure that we don't live some certain life that will not give glory to God, or will not honor God through our body, through our body. I see a lot of people, undergoing some certain things. We'll still be talking on that, but right now, which we are about to conclude, is urinary system. Even though we won't be able to go straight to the reproductive system, because we have some people to attend to right now. A lot of messages is coming in, and we need to attend to some certain people, on the other platform, which is our WhatsApp and all that. So we'll be bringing this to an end in soon now. Okay. Yes, I will attend to that. So as a matter of fact, you have to keep your body, you have to keep your healthy state of mind. You have to make sure that you are living right. You don't live some certain life. So for you to know more about how to maintain your health, you understand how to keep your body in a good condition. You can reach us out, you can message us, you can call us, you can send us direct messages. Notwithstanding, we started this on this section today, on this channel today, and more is to come. More are coming. So that is that on that. Please, we should take note of our body system, and we should make sure that we are living right. A lot of things that we do at times that we think we are living right, but which is very wrong. It is only those that are in that line, in that profession, that will make us to understand that what you're doing is not right. Even though your body even though you feel merriment while you're taking it, while you're living the life, but not knowing that your body is not happy with what you're doing. What you're introducing to your body system is not happy with it. Take, for example, you love smoking. You love smoking some certain acanoids. I call it acanoids. I will call it acanoid. I will not mention the name of the drug. But I will term it as acanoid. Acanoid in so many ways. You can have acanoid in some. There is a particular smoke that when you go to market and go about, they write it at the back that smokers are liable to die young. So please, whatsoever smoking aspect, or there are some certain people that they say there's something they cook in a pot. It's not have a pipe like this in the club. So they used to pop that thing, even though guests love it so much. I don't want to mention. Please, whatsoever it is that you are taking, which is smoking things, whatsoever smoking, even they tell you is in a pot. No, it's the same thing. This will surely damage your kidney. We are talking fully on kidney, on the urinary system today. We damage your kidney. So please and please, I'm urging us to make sure that we live right. We consume something that is right. You don't consume something that is wrong. You don't consume toxic substances and you think that it is something. When you are consuming all these things in the club or in the parties, when you're smoking, you feel high. It gives you some certain merriment. But your body system, some certain organs in your body system is not happy with it. some certain organs in your body system, they are not happy with what you are consuming. But there are some some certain organs, like your pituitary organs, like your pineal organs, like your let me say, like your endocrine system. Your endocrine system, maybe they are happy with it, you understand. But the moment they begin to the moment all these chemicals begin to react, because they are toxins, they begin to react, they are toxins to the body system, begin to react negatively. All these hormones, they won't be able to bear it. All these organs won't be able to bear it because there are chemicals that damage the body. But the moment you are taking them, you feel like your melatonin, your endorphin, your adrenaline, your serotonin begin to increase. You begin to feel lively. Your oxytocin release. Maybe you want your oxytocin to release. You want the hormone responsible for the release of oxytocin to just give you some, your melatonin, your, the likes, your adrenaline, your serotonin. You just want them to come up. And this thing is giving you the vibes. Yes, they'll be giving, all these chemicals will give you the vibes. And they are giving you the vibes for the moment. Why for the future is total damage of the kidney. And other cells, and other organs, but I'm still going there. Most especially your liver. Because the kidney and the liver, they work hand in hand together. All the whole system work hand in hand together. But we are saying the ones that are closer, that are closer, that are more closer, that relate one-on-one. They are like twins brother. So please and please, you are getting something that is mesmerizing you. Think about the disadvantage if it is beneficial to some certain organs in your body system. If they are not beneficial to some certain organs in your body, you will better stay away from it. Even though there's some people said, yes, it is my doctor that said I should be taking this. Yes, your doctor said you should be taking it. It does not say you should be taking it the way you are taking it. Yeah, there are some certain health conditions that warrant you to be taking some certain things. Yes, and these things that they're saying you should take, even though it is toxic, why all the old system, everything that we are taking, we are consuming, even fruit and all that, they are all toxins. But when they become poisonous or toxic when it is too much. When they are too much in the body, they turn to toxins. They become toxic and became, poison. Now begin to damage the cells one by one. So please and please, let's take note of that. Don't let us consume what is not consumable. You understand? So we are ending this live section right now, and tomorrow, by God's grace, or later at night, we are going to continue. That is overnight. We are doing this by we are going to come back live by 12 a.m. midnight. By 12 a.m. midnight or 11:30 at night tonight, or 12 a.m. midnight, for the people outside the country to benefit from this health tips, on certain system of the body, on certain organs of the body system, and on how to live a healthy lifestyle, and how to maintain some certain homeostatic conditions between the hormones and the electrolyte, also combination with the organs and the whole body system. We are giving these health tips based on the fact that everybody needs to understand, to wake up and understand what to do at the right time. Even though anybody just prescribe drug for us, we'll be able to understand how to do that. We are still going to enlighten people on how to read and understand drugs before consumption. Even your doctor said you should use some certain drugs in so. We'll even introduce you, we enlighten you how you can also do some research on the drug and get to know if it is the way it should or not. So I believe your healthcare provider, your healthcare practitioner, if they are the right one, they will not lead you astray. And by God's grace, we are available for you, and you can choose us at BMS Healthcare Medical Consultancy and Services. Your wellness is our top priority. Through God has sent us. Amen. My phone number is 070-899-79560. Once again, 070-899-560. I mean 070-899-79560. That is my WhatsApp number, and also it is a direct number. You can join our channel on WhatsApp. When you click on the WhatsApp, you see our channel. You can join our channel for daily tips and all that and what to do. And it will also give you a chance for you to talk to us at any time, because it is a benefit, it's a bonus for you guys. So reach us out, and soon we also own a charity foundation which we tag, or we call BMC Charity Foundation. BMC Charity Foundation is an organization that is reaching out to people in diversified area, most especially fundamentally on how to live a healthy lifestyle. And we used to give palliative. We used to give palliative to people when it comes to healthy living, like medicine, like some certain things, health kits like that. We used to distribute to people. We used to have this program done. We used to have the program done once in a while, once in a while like that. And very soon, when we become more larger, we'll be doing this program weekly, reaching out to people, going to the rural area, going to the urban area, organizing the program. But the ones we have been doing now, it is not so constant, but it is something that we do on a regular basis like that. Once in a while, we do that. It's a big, large program that we always gather people together, and under the supervision of BMS Healthcare Consultancy and Medical Consultancy and Services. So we used to reach out to the people, and we used to collaborate with some certain churches and all that, with some certain organization, so that we will be able to sensitize people on how to live a healthy lifestyle. You can join our channel for you to know more. You can subscribe, like, and tell us whatever it is that you understand that you want to share with us. You understand? So please kindly share with us. We will always love that. We will always love that. Igi kan kì í dágbó ṣe. Ẹ jẹ́ ká sowọ́pọ̀ ká jọ ṣe. God bless. Thank you.